Good morning. It's just after 11 o'clock, so let's get started. And I see we have quite a number of participants already joining us, and I'm sure there'll be more as in the next few minutes. I'd like to take this opportunity to welcome everyone to our BC Healthy Communities 2022 PlanH, an introductory webinar for applicants. My name is Julie Leggett, and I'm the PlanH delivery lead with BC Healthy Communities. And I'm very pleased today to be joined with my colleague, Stacey Chappell, our Grants and Engagement Coordinator. This morning, we're pleased to share and do our best to answer this year's questions about this year's grant application process. We're also hoping to get a sense from you, our community, what you're looking for and who might already be applying. I'll do a land acknowledgement once more folks have joined, but for now, as we wait, many of you have already, and I ask that if you haven't and you can, please use the chat function here in Zoom to introduce yourself, the organization that you're representing today, and then the territory if you know it. And I see if you're not quite sure, there's been a link posted in the chat that you can check out where you're located. Okay, so let's move on to our land acknowledgement. I'd like to take a moment just to acknowledge that BC Healthy Communities offices are located on the surrounding traditional lands of the Kosapsan and Lekwungen Nation, where we work, live, learn, and play. Next slide, please. Thank you, everyone, for entering your name in the chat. I see we have people from many places across the province, and welcome. Just a quick reminder, Stacey already mentioned that today's webinar will be recorded, and it will be posted later today or tomorrow following, once we finish up here. Those who have registered will receive a copy to the link in the email that you receive. I'd also like to take a moment to thank our behind the scenes crew. We can't do this without them, that's for sure. We have Jacob today, Yvonne, Abby, and Stephanie, who will be working with us behind the scenes to ensure all things tech run smoothly. And that during today's event, they'll be chiming in, as you've already probably seen, with links and resources. If you have specific questions that you want to ask, we will be saving some time at the end for that. And we ask that you just paste them into the chat. There's a little button down at the bottom of your toolbar, and then our staff will collect them and we'll go through them at the end. We anticipate that today's presentation will take about 30 minutes, following which we'll do the Q&A. So during this time, in the next 30 minutes, the formal presentation, we'll start broadly and talk about BC Healthy Communities, what our organization is about, the PlanH program, what a healthy communities approach looks like. And then I'm going to hand it over to Stacey, and she's going to get into the nitty-gritty about the grant application process, the ins and outs. And then we'll wind up with a quick discussion about additional supports that we offer. And then, of course, all of your questions we'll do our best to get through. Next slide, please. So just a little bit about BC Healthy Communities and the PlanH program. The BC Healthy Communities Society has been around since about 2005. It's a province-wide not-for-profit organization that facilitates the ongoing development of healthy, thriving, and resilient communities. We here at BC Healthy Community Society, or we like the acronym, it's a little easier, BCHC, believe that it is possible and actually quite necessary to create communities where it's easy for citizens to be healthy and well. So really, when we're looking at healthy communities, we're taking a holistic approach. And we operate at the intersection between planning and public health. Next slide, please. Since 2012, PlanH has provided both cash grants and in-kind supports to communities with a total to date of 225 projects funded across the province. Our PlanH program supports local and Indigenous government engagement and partnerships across sectors for creating healthier communities. We provide learning opportunities, resources, and leading-edge practices for collaborative local action. Recognizing that community policy, plans, and decisions affect health and well-being. And we do this all in partnership with the Ministry of Health, supporting the province's health promotion strategy. I'd like to also mention that new this year, we've received additional funding from Vancouver Coastal Health Authority for healthy public policy in that region. Next slide, please. I just want to take a moment just to talk a little bit about what we mean by a healthy communities approach. This approach recognizes that the built environmental, social, and economic environments play a large role in determining health and well-being. These factors that focus on changing the structures to create positive health outcomes in populations are called the social determinants of health. So when we look at that, we know that it takes more than just encouraging individuals to take action to choose healthy behaviors. In fact, the evidence shows us that between 60 to 75% of factors influencing our health lies outside of our healthcare system. So when we look at things like transportation, housing, available recreation opportunities, supportive social networks, and community design, all of these external factors outside the individual go a long way to making it easier for people to lead healthy lives. We also, when we talk about upstream interventions, what we're saying there is that an upstream approach focuses on preventing poor health outcomes rather than responding to them once they have developed. So it really looks at addressing those social and structural determinants of health. It takes place in our daily lives where we work, live, learn, and play. And ultimately, the overall goal of an upstream approach is that we want to decrease barriers so we can improve the supports that allow people to reach their full health potential. So here at BCHC, we believe at the heart of a healthy community approach is a fundamental commitment to equity, ensuring that systemic disadvantages don't get in the way of community members' aspirations for their lives and the lives of their families. So when we talk about applying an equity lens, what we're asking is who is going to benefit from a policy, program, initiative, or service, and asking the sometimes tougher question, who may be excluded, and then looking at reasons for why. So when we look at these three concepts, the social determinants of health, upstream interventions, and equity, I want to mention that they're also highlighted in more detail in the application guide, along with some examples of how different ways that local and Indigenous governments can take action using the healthy communities approach. Next slide, please. At this point, I'd like to hand it over to Stacy to speak more in detail about the PlanH grant application process and the program itself. Over to you, Stacy.
Thanks, Julie. And thanks everyone for coming. Like Julie, I'm thrilled to see such a big group of people here. And again, I'll echo her thanks to our team in the background who make doing this possible and have been helping us rehearse and everything all week. So my role at BCHC is Grants and Engagement Coordinator. And that means I'm your contact for administrative aspects of the PlanH grant program, and that includes the application process. So we'll be posting links in the chat to the grant program website, but you can also find those at any time at planh.ca and bchealthycommunities.ca. The PlanH grant program is structured to offer two components to recipients. There's a financial component And there's also in-kind supports provided by BCHC staff to the communities receiving the funds. In addition to that, the program identifies 2 streams every year, each of which focus on a different aspect of healthy communities. And in 2022, our grant stream themes are community connectedness and healthy public policy. So I'm going to go through in more detail the eligibility criteria, the application and adjudication process, and some details about the streams, and then I'll pass it back to Julie to talk about community supports. So next slide, please. Of course, the first question that anyone will have about this program is, am I eligible if you're writing a grant? And so for the PlanH grant program, a local government must be the primary applicant. And by local government, we include municipal governments, Indigenous governments, and Métis communities, and we also include regional districts. So you can see on the slide the full list of eligibility criteria, or sorry, the eligible groups, and also the list of those who cannot be the primary applicant. So if you're somebody who can't be a primary applicant, please note that if you have a project that you're doing in partnership with the local government, and that project meets the funding guidelines, the local government can apply on behalf of the partners involved in the project. So you can work together between the eligible groups and those that are not eligible to be the primary applicant. So next slide, please. As we noted, we have 2 streams, the community connectedness and the healthy public policy grant streams. So I'll tell you a bit about each. For community connectedness, there will be about 20 grants of up to 5,000 each awarded. And this stream recognizes that social connections are a vital aspect of healthy communities. This stream aims to reduce isolation and improve a sense of belonging. Some examples of projects that would fit into the stream are events that focus on community building, that rebuild connections between people as we emerge from COVID, that aim to include groups that have been underrepresented in activities, or that address the mental health impact of the pandemic. Those are just some examples. And for the healthy public policy, we'll be giving out 10 grants approximately of up to $15,000 each. And projects in this stream will be looking at developing or amending policy to improve health and well-being of community members. Eligible projects could include policy analysis, public engagement, research, implementation, and evaluation processes. As Julie just mentioned, in addition to that, Vancouver Coastal Health Authority is partnering with BCHC to support 15 additional healthy public policy grants to communities within the Vancouver Coastal Health region. There's no separate application process. Communities for Vancouver Coastal Health will be considered for that automatically. So as mentioned earlier, each grant comes with both the funding and the in-kind supports from BCHC staff. And if you're interested to see some examples of past projects that were funded by PlanH, I think there's been a link posted. So that's to a site about social connectedness projects. And if you scroll down, you'll see some links to some good examples at the bottom of that page. So the next slide, please. The application process is done online. And we use a web form. And just to let you know that the application deadline is June 1st, midnight Pacific time. And we recommend reviewing the application guide before completing your application because it provides a lot of information about the grant program's philosophy and goals, and also tips for making a stronger application. So every application will need to include a project overview, a high-level budget, and a work plan. And the project overview will be captured through the web form, which includes questions about proposed activities, goals, and outcomes, and also about how the project will incorporate equity and your plans for evaluating success. We've posted the application questions on our website so you can prepare in advance of applying. And I'll just mention that we're posting some links, one for each grant stream, and all the items I'm listing in this part, you'll find a link to those in the grant stream site that's being posted. So the second piece you'll need is a high-level budget, and that budget should include the total project cost, not just the components funded by PlanH. So you'll be asked to include other revenue sources, including in-kind contributions in there. You should also know that for the PlanH component of the funding, only 40% of the PlanH funded budget can be used for capital costs. So capital costs are equipment, building costs, sort of permanent structural costs. So for example, if you're a community that's interested in the community Connectedness grant stream, where the grant is a total of 5,000 from PlanH, only 2,000 of the PlanH funds could go towards capital costs. Like the budget, the work plan is intended to be a high-level overview. So we ask you to list the major project milestones, identify who you expect to be responsible for that milestone and the estimated date for completing it. There's an Excel template of the budget and work plan in one Excel document, and you'll be asked in the web form to upload the budget template, the budget work plan template. It's optional, but encouraged to include supporting documents with your application. This could be anything from letters from partners in the project to reports or surveys that informed your decision that this project was needed. Anything that you think supports our understanding of the significance of the project to your community. So as I mentioned, we've posted links, one to each grant stream, and in that link, you'll find for that stream, the application questions, the application guide, the link to the web form to submit your application, and the link to download the Excel template for the budget and work plan. So we do know that internet access can be a barrier or sometimes is intermittent in some of communities across the province. So if using the web form simply doesn't work for you, please do contact me to make alternate arrangements. My email is grants@planh.ca, and don't worry, we have a contact slide at the end. And similarly, if the web form is fine, but uploading documents tends to produce a barrier for you, within the web form, there's always an option to email documents instead. So you can go through the web form and submit them by email, and they'll be paired to your application as part of that. So, but do contact us if you encounter barriers to do that. So next slide, please. Thank you. So throughout the application guide, you'll find tips on how to strengthen your application. These point to the features the adjudication team will be assessing when we're considering and deciding on which project to select. So just to give you an idea of the kinds of things we're looking for, one thing we'll be looking at is to see whether the project has used an equity lens. Is your project making healthy community accessible to everyone, especially those who need it most? Is your project focused on a group that's been underrepresented? Tell us how equity is incorporated into your plan. We'll be looking to see if you've demonstrated meaningful partnerships. Is there a collaboration with your health authority? Or perhaps there's a plan to work across multiple sectors in your community with a variety of organizations and supporters. We found in past that partnerships mean projects will be more sustainable over time. So the partnerships don't have to be set up entirely before you start. If you have a plan to build a partnership as part of the project, do mention that. That's totally fine. If you have existing partnerships, that's great. And as we mentioned, letters of support are not required, but if you have them, please include them because that helps us understand your project. So partnerships are a way to make projects sustainable, but there may be other ways. So if you have ideas about the benefits of your project and how they can be extended past the grant year, please do share those ideas in your proposal, because we are looking to see how sustainable a project can be and how its impact can be extended. Finally, we're always interested to hear your plans for evaluation and measurement. If you have a plan to evaluate your project, please tell us about it. Are you going to collect data? Is there going to be a report as part of the components of what's developed? Are you going to collect data on how many people attended? Tell us how your evaluation and measurement is going to work, because that helps us see how you're connecting the work into the broader goals of the community. I do also want to note that we're always happy to discuss your project to you If you have questions about whether your idea is a good fit or whether a component is better or the other component, please feel free to schedule a consultation with me. I'm happy to talk to you about it. You can also just email me if you have quick questions or phone. You'll find we have an FAQ site. I think we're going to post a link to that as well. So many links. And a lot of our most common questions will be answered there. But again, don't hesitate to contact us if you're unsure about something. And I think next slide, please. Okay. Just again, reminder, our deadline to apply is midnight, June 1st, Pacific time. So everyone that applies will receive a notice of the result in early July. If your project is selected, the projects will start in September 2022, and we expect the projects to end September 2023. There's a requirement to submit a final report, which is done again as a web form. And then it'll include a budget report to show where the funds were spent. And the funding is, and that is due October 1st, 2023. So mark your calendars. And the funding is issued in two portions, 80% at the start of the project once the financial agreements are signed. And then at the end, the last 20% is issued once the final report is submitted. So that completes my overview, and I'm going to pass it back to Julie, and I'll be back later to help with your questions.
Awesome. Thanks so much, Stacy. So just to recap, the Healthy Communities Grant Program has the two parts. The cash grant, which Stacy just spent some time going into detail a bit about and how to go about applying for that. Then there's also the in-kind support that our staff here at BCHC offer. So that support could range from consultation by phone or email, and we're optimistic that we'll get back to face-to-face or in community collaborations. Our role to support your community in building capacity can look quite different depending on what you're looking for. Some examples, so supporting monitoring and evaluation strategies, sharing resources developed by our organization or others, researching various topics, and developing in-person and online community engagement processes. I encourage you to check out the application guide as it provides more details as to the list of the range and types of in-kind supports that we provide to our funded communities. So basically how it works is that all grant recipients participate in an onboarding call where we have a great opportunity to introduce ourselves and to have a conversation and take more time about how BCHC staff can support you in achieving your project goals. Next slide, please. So just to wind up, thank you so much, everyone, for signing up and listening in on our presentation today. And I guess, I mean, you've heard it a couple times, but if you take nothing else away from today, please take this slide and this information. What we really want you to do is we really strongly encourage you to reach out and contact us with any questions about the application process or your proposed project before the June 1st deadline. As Stacy mentioned, she's our point person, and you can reach Stacy at grants@planH.ca, and her phone number is also located on the slide. Okay. And next slide, please. All right, so it's getting close to 11:30 now, and we have several minutes, 15 minutes or so for questions, and we'll begin with those in the chat now. What you can, with Zoom, there's also, I'm sure everyone's familiar by now, but there's a separate Q&A chat box that you can enter your questions into, and we encourage you to do that now. And we realize that not everyone can stay, and we want to take this moment just to thank you for coming. And for those staying, please continue to add your questions into the chat. I'd also like to take this opportunity to do a little shameless plug here for another webinar that we have coming up in a couple weeks. And it's on April 28th, and it's called the Emergency Food Response, Developing a Framework for Action. It's looking at applying an equity lens to emergency food planning, supporting local and Indigenous governments to strengthen their capacities around responding to food emergencies. So now I'm going to take some questions. Sure. Okay. So here's one question, and I'll invite Stacy back on as well if your camera's
Sure.
Thanks, Stacy. So here's a question. Would you suggest we prioritize the application that would benefit our community the most? And there's a second part to that. Or apply for both and let BCHC decide which project has the potential for the greatest impact?
Yeah, thanks, Renata, for that. That was a follow-up question, I think, about whether it's possible to apply for
Okay.
both streams at the same time. And yes, it is possible. And but you're unlikely to get funded for both. So it's up to the applicant. It won't work against you to apply twice. But it is it's a fair bit of work to put together a grant application. So I'll let you decide whether it's worth it for you, but it won't work against you to submit both. So if you have two that you can't decide which is the strongest or the highest priority and you're hoping to move forward on, for sure, put both in.
Or it might be just maybe even giving Stacy a call just to talk them through to see which one might be a better fit too would work.
Yeah, you're welcome to talk through the two with me to see, just in case one of them isn't really eligible or isn't a good fit, then that would help you reduce your work.
Yeah, yeah, we all need that nowadays.
Yeah, right.
All right. Okay, so could you clarify what type of activities are eligible for the healthy public policy stream?
Yeah, so this stream is intended to look at sort of systemic or policy change, upstream change. So it could involve anything from a community consultation or developing new policy. If you've had missed a community hasn't really been showing up for consultation on a key policy that has an impact on healthy communities, you could use the grant to improve your reach to communities where there's gaps. So I think beyond that, I'd say feel free to reach out to me with some of your ideas and we could talk more specifically about whether they'd be a good fit. I hope that answers.
That's great. Thanks, Stacy. If an organization has received the Healthy Public Policy grant a couple of years ago, can they apply again to the same grant stream with another focus?
Yes, you can. And you'll be asked if you've had a past grant in the application. So you would mention the grant. And then we'll be looking for you to show how this new proposal is taking a different tact than the previous work. So it's not repeating the work, or it's building on the work from the past project. One thing we also require is that past grants have been completed so that the final report has been done and the final budget has been done before you submit for another granting year.
That's a great point. Thanks, Stacy. So one more here from Josephine. If submitting a grant, we can connect with PlanH to help assist with the grant.
Yes. Absolutely. Yes. So the way to do that would be to reach out to me at grants@planh.ca, or you can give me a call and we'll be sending the links to everybody that attended. So you'll be able to do that. I'll be following up with people that attended to let you know my contact information, but absolutely, please do contact me to discuss your grant. I won't help you write it, but I will certainly discuss your ideas and help you understand what sorts of projects are a good fit. Oh, I'm not hearing you, Julie, I think.
Oh, sorry about that. So this is from Naomi. If our project and community spans across 4 different local governments, and we have support and interest from all 4, Is it okay or advisable to request the equivalent of 2 or more grants to cover the entire region? So for example, can we request 10,000 as 5,000 would be difficult to stretch across our entire community? Thoughts on that one? I think.
Oh, I think you might have stumped me. So, so it's unlikely that we would. We do have regional districts apply for programs that span across a couple of communities, but they are not able to take the same project and apply multiple times for the same project. So I would say that you could be partners in an application, but the same project couldn't be funded multiple times, if that makes sense. I think I'd need to maybe understand a little bit more. Maybe we could talk about the specifics. Maybe there's something I'm not understanding, but the same discrete activity, regardless of the scope, like whether it's regional district wide, for example, you can't have multiple grants for the same one. It sometimes happens that there's multiple communities doing a similar thing, but they're discrete projects. But again, feel free to talk to me independently to talk more details about your idea.
Yeah, so what you're saying basically is one project, regardless, even if it's a large region or a small municipality, but it's based on the project itself, the application, and what the project focuses on. So one project would not necessarily receive the 2 grants. It would be 1 grant per project, and then partnerships within that project, and sort of the way I'm understanding it. And Naomi, for sure, reach out to Stacy and have a conversation. It sounds like that could be a really interesting angle that you're taking, for sure. All right, here's another one. Does the Healthy Public Policy Grant take into consideration decolonial understandings of policies and procedures, relationship-based, and led the medicine wheel?
That is a really great question. And yes, we would be very open to, and actually very excited to see applications that are looking at public policy through an Indigenous lens. And we know many people might be partnering with their First Nations Health Authority, for example, and using the policy models that they bring in. So that's absolutely welcome.
That's great. Yeah, thank you. All right, here's another one. Can we utilize the funds to pilot a program that has shown success in another community, or does it have to be a new idea? So kind of modeling another.
Yeah, that's a great idea. Yeah. Good question. And yes, that is welcome. Building on success shown elsewhere, I think, is a great way to show you've done your work in understanding how to innovate and how to build on existing success and learn from the experiences in other communities. So definitely that's welcome.
Okay, great. One more here. Is funding for a cost sharing agreement, or would PlanH fund the entire project if within the funding limits?
That's a really good question. And I don't think I said that when my comments about budget, because I was talking about make sure you list all your sources of funding. If you don't have other sources of funding, that is acceptable. It's just that if you do have other sources in a broader budget, that they should be listed in the grant. So that's really important to note. Thank you for asking that question. So yeah, you do not have to have other sources in the program.
Okay, great. And there's a comment here from Naomi as well, just saying that their population, the one that she was talking about, the regional, is about 30,000. So
right. Yeah,
interesting. Yeah, thanks for that, Naomi, for sure. Am I missing any other questions, either in the Q&A or the chat? I think or have we covered them all? Okay. All right, I think that's a wrap, unless I've missed something, and I apologize for that. Um, Thank you everyone again for coming. And again, we mentioned reach out to Stacy, please, with any questions. There sounds like there's a lot of great ideas out there, and we're really excited to see what comes forward with your application. So please continue on with the process. If it looks like it's going to be a good fit, contact Stacy. And again, thanks to our backup, our behind the scenes crew with all the help with the tech today, and to my very wonderful colleague, Stacy. Thank you so much for all the work that you've done here today. And thank you again, everyone, and have a wonderful rest of your afternoon, or morning. Thank you. Anything else, Stacy?
No, just a big thank you to everybody for coming, and thanks to everybody else for
All
coming.
right.
Thanks, Julie.
Okay. Have a great day.